What's going on? Thanks for your interest in watching these videos. I hope to help you more than what you've gotten out of maybe some doctor's visits, especially giving you more information than Dr. Google, because I know that's where a lot of you search, and maybe that's even how you found me. But through these next couple of videos, I hope to introduce you to a progression of learning about your condition, what you can do about it, what's successful, what's not successful. And at the end of this, hopefully you've gotten more information than you ever have before about why your foot pain is still there. So I'm Dr. Dave, and Dr. Dave Heitman, and I previously ran a sports medicine clinic. I'm a chiropractor by trade, and I helped a lot of people with their feet. Lots of people just like yourself. I became known as the expert in my town, and people would float into my doors through their medical doctors. They would refer them to me. They would come in through the sports teams that I worked with. And I have a couple of stories for you that I want to share on why I think this video is going to be so impactful for you. So number one, the first story that I want to tell you guys, oh, it's weird in that I wish I could say this was only a one-off story, but this is actually a story that happened a lot in my office. Not just a couple of times, a lot. Is that patients would come in and they'd say, "Doc, I've had foot pain for 3 months, or I've had foot pain for 6 months, and I've done this, this, and this, and I'm just not getting better." Okay, well, what did the doctor say that you had? Well, I have plantar fasciitis. Great, let's check it out. I go to look at that person's foot, and lo and behold, I say, "Where is your pain?" And they point to the top of their foot. Now, you may or may not know what plantar fasciitis is, but the biggie here is that plantar fasciitis is on the bottom of the foot. And time again, a patient would come in and they would point some other place on their foot. And they would say, "My doctor prescribed, or told me a diagnosis of plantar fasciitis. I went to physical therapy. The physical therapist never said anything." And I looked at it, and this is one of those things that almost made me laugh and cry all at the same time. It's like, I feel so bad for these people because they've been misled. So the point of this video today is I'm going to get into what I would go into my office as a lot of the common misconceptions around being diagnosed, a lot of the misconceptions around where pain is actually coming from in the foot. And hopefully by the end of this, you'll have a much better understanding of your actual problem. And then in the next video, we'll go over things like what treatments work, what treatments don't work, why you're not getting better, why you're not seeing the relief that you want to see. And so this is the progression that we'll go over today. And so to save on time, I will tell you, I'm not using any fancy diagrams. This is after thousands of patients that I've treated in my office, by far the best Dr. Dave example that I can give you. These are my simple little drawings that I would do in my office. And I know for a fact that this is the best way for people to become educated about what they have going on. So enjoy the ride with me here. I'm going to get started with some plantar fasciitis stuff. I'm going to go a little bit over a nice little close-up here for you. Plantar fasciitis is simply, we have a bone coming down, our leg bone. We have our heel bone. We have our arch here. We have our toes. These green lines are our ligaments. So this is the bottom of our foot, and this is our calf muscle. So right here, I want you to focus on this red arrow. This is where plantar fasciitis actually is. Now, plantar fasciitis is actually a fraying of that green ligament there. It's actually tearing right at that spot, right where it attaches to the heel bone. Okay? No other spots, no other place on your foot. There can be some referring pain, but if you are pointing somewhere else in your foot, you have a different type of pain than plantar fasciitis. Now, the two other most common things that was misdiagnosed that I would see in my office is that plantar fasciitis type pain, where there's actually a muscle, show you right, there's a muscle right, oops, used to doing this on a whiteboard, by the way. There's a muscle right at the heel bone that goes into the arch that can give plantar fasciitis type of pain. And the reason, or the way that you can delineate is if you just touch the bottom of your foot, you can find your heel bone. You will be able to find your actual plantar fascia. It's a tight ligament going across the bottom of your foot. You find that, then you put your finger off of it just a little bit. If you dig down into a little hole feeling, you'll actually feel a sore muscle in there. This is one of the common misconceptions about where plantar fasciitis is coming from, and also one of the root causes on why a lot of diagnosed plantar fasciitis doesn't actually get better. We'll get into that into the second visit, or second video, second visit. So at any rate, the second way that plantar fasciitis commonly gets misdiagnosed is actually a nerve. And it's a nerve type of pain that comes from a dysfunction of the foot. That dysfunction is actually up through here and here. It's actually the ankle joint that has a problem moving, and it has to do with tight tissue through here. And we'll also get into that in a second. But this also leads me to the next point of Achilles bursitis. So moving past plantar fasciitis, getting into Achilles bursitis, maybe you've been diagnosed with that. This is where, quite simply, there's a balloon, and it's in between your tendon and your bone, and that balloon is actually meant to be there to protect you from sliding back and forth and causing an irritation on your tendon. What happens is that, again, that tissue gets tight, and this is why I'm putting this right into this category, is this tight tissue squeezes the balloon, and it makes that bursa irritated, okay? So that's really important for when we get into the second video. This is the actual cause of a diagnosis of Achilles bursitis. It's an inflammation of a fluid sac. Another common problem, this is my lovely foot diagram here. These are toes. This is what's called your midfoot, and this is your heel bone. This is as if I was looking down at the top of your feet, okay? Bunions and hammer toes, yes, all right. A bunion on the big toe, get it here. Actually, this will be better. So a bunion would be right here on the big toe, okay? What a bunion actually is in the first couple of stages of being a bunion is actually the toe literally falling off the bone. It's actually not a bone growth at this point. So I want to make this very clear that it is a dysfunction, not a growth, or a lot of people call it a bone growth. That knob sticking out is actually the bone that's supposed to be there. It hasn't developed usually into, usually hasn't developed yet into a big bony complex. It's not until the end stages of a bunion where we actually get a whole bunch of extra bone growth and those sorts of things. Same thing with a hammer toe. Hammer toe is when your knuckle of your toe comes up like that compared to the rest of the toes. This is actually a dysfunction, not a growth here. It's not something that should be cut out or anything of that nature. Hammer toes are simply a sign that the foot complex is not working. So let me get into that a little bit, because this is where the actual explanation comes for all of these conditions. And I want to make this very clear. In my office, when I saw this, there was a lot of people that would come in and they're like, Doc, I've got this pain right here. Great. The pain right there, however, is not why all of this stuff happens. All of this stuff actually happens because of the dysfunction that I'm talking about. So this happens over time. This isn't something that happens immediately. Although you may feel it immediately, a lot of people do come in and they say, Bam, suddenly I had plantar fasciitis. Bam, suddenly I had Achilles bursitis. But the reality is that we had a lot of dysfunction happening before that actually happened. We had tightness in our calf. We had loss of our ankle range of motion. Maybe we started shuffling and we didn't know it. A lot of us lose our ability to get out and play, right? We know this because we sit at desks, we work, we don't get out and hit the monkey bars, right? We're not climbing trees, we're not climbing boulders. All of those things are what actually keep our feet healthy. Our feet are designed to be a big spring system. If you imagine back as we evolved, we were meant to jump up and down on things. We were meant to be running through the grass barefoot. We were meant to be climbing trees, but we don't do that stuff anymore, right? We wear shoes, we're on hard, flat ground. We never have to really challenge our feet to keep the tissue healthy there. And what you don't use, you lose, right? We've all heard that saying before. Sit-ups, whatever you want to call it, whatever example you want to remember that from. But if you don't use it, you lose it, right? And so our feet become very tight. They become very dysfunctional. And that is actually the root cause of why a lot of these diagnoses are there. So in the next video, I hope to explain to you and show you the path of common treatments, why they work and why they don't work, and getting after what this dysfunction really is. I hope to really just get after it, show you the way, and allow you to feel like you have a confident path to keep moving forward. I look forward to sharing that with you in the next video. Thank you.